And so, what are the ketogenic diet has become more common in recent history. People are talking about it more. What are some of the things that the ketogenic diet is being used for or studied for in terms of therapeutic and the health side of this? What types of people are looking at the ketogenic diet?
Well, I mean, so yeah, it's definitely associated with weight loss. It's actually a fairly significant way to lose weight because the low carbs means low calories, and if you're taking in less calories, you're going to lose weight. Your body also shifts to this burning of fats, which is also good for weight loss. So it's a very dramatic way for some people to lose weight in the short run. But we've seen it for patients with diabetes to help their blood sugar control because carbohydrates become sugar in the bloodstream. So that's good for patients with diabetes, both type 1 and type 2 diabetes. And it's also been used for things like seizures. There's the Epilepsy Society and Epilepsy Foundation have advocated as an effective way to manage epilepsy. And there's a host of other purported benefits, and different people have used it for gastrointestinal disorders, for problems of their gut, and a host of other uses that have been purported. I'm not an expert on the keto diet, to be honest. I did a research study on it, but I know it's used for a fair number of different people across different aspects of healthcare.
Yeah, yeah. So this ketogenic diet, it's being looked at and used in for a variety of purposes now, ranging from something very, let's just call it physical, like weight loss, shedding body fat, but also things like mental health and even things like epilepsy. That's the sort of classic first thing I think it was known for. So before we get to your study, the one that you just published, I want to cover off on a couple more things. So there's something called the lean mass hyperresponder phenotype, and this is going to tie into how being in ketosis relates to things like LDL levels. What is this phenotype, and what do we actually know about it to set up the study?
Um, so um, the lean mass hyperresponders is a group of people who start out without a lot of body fat. So they're healthy, they're lean, and for some of them, when you go on the keto diet, for whatever reasons that they might choose to do that, their body makes more LDL cholesterol. So they're called hyperresponders, where their LDL cholesterol goes up dramatically. It could go up from normal values, 70, 80 milligrams per deciliter, up into the high hundreds. I've heard of people going up to 1,000 LDL cholesterol in response to this diet. So their metabolism shifts. They're probably using LDL to try to deliver energy because they don't have a lot of fats, they don't have a lot of triglycerides, and their LDL particles go up dramatically, and they have this hyper response to cholesterol.
Okay, so these are lean, metabolically healthy people. So if you're to look at their blood work, they would have, say, a low triglyceride HDL ratio. So they've got enough HDL. Their triglycerides are low. That's good, but they have very high LDL numbers. Even though they have very high LDL numbers on this high fat, low carb diet, even though they are lean, metabolically healthy, and don't appear to be predisposed to, say, heart issues or something like that.
Right. Correct.
Okay, so now I guess the question here naturally is if they look otherwise healthy, but they've got very high LDL levels, which are classically known as your bad cholesterol, the question is, are they actually at risk? Is this high LDL level actually bad? So what's been the thinking there going into your study, and what are the sort of different ways that cardiologists and people in these fields would think about this in terms of whether or not it's actually going to turn out to be good or bad for these lean people?
Yeah, and I think just out of the box, people reflex says, "Oh, if your LDL goes that high, that's terrible. We have to do something about it. You're at high risk because your LDL cholesterol is so high." And people have said you have to stop the diet, you have to change your lifestyle, you have to get on a statin. There are other people who believe that because it's just a physiological response to energy transfer, and these people are otherwise metabolically very healthy, that it would not be a significant problem. and therefore would be okay, if you will, to go through to have that high in LDL cholesterol as long as you're otherwise healthy.
Mm-hmm. So what I'm hearing is, so if the first viewpoint is correct and having those high LDL levels is bad, even though these people are lean and metabolically healthy and otherwise look good, the prediction would be that having those sky high LDL levels for an extended period of time is going to cause more plaque buildup. So we should see these people build up more and more arterial plaque, given that their LDL is that high. The alternative viewpoint, or and a different way of looking at this, is that these people are lean and metabolically healthy. Their body is using more fat for energy as opposed to carbohydrate. And so the high LDL is not a reflection of something bad happening and plaque's going to build up. It's a reflection of their body moving around fat to use for energy, basically.
Correct.
Okay. And so set up this study for us a little bit. I think we've essentially covered off on some of the motivation here. What did you do in terms of the basic setup and methods of this study?
Yeah, so we were very careful in our patient selection. We actually screened a lot of people to find these people who were, one, in ketosis from the ketogenic diet. So we had to prove that they were effectively in the ketosis state, where ketone bodies measurable in their blood. Two, they had to have an LDL well above normal. And three, they had to have a normal LDL prior to starting the keto diet. So we excluded patients genetically as well who could have had what we call heterozygous FH, or high cholesterol from a genetic predisposition. So these were patients who had normal cholesterol. They had no issues with LDL cholesterol. It was very normal. And then they went on this diet and it went up dramatically. And those are the people who we enrolled in the trial.
I see. So you specifically wanted to look at people that did not have some genetic predisposition to very high LDL cholesterol. You wanted their LDL to be high because it was induced by being in a ketogenic diet state, by being in ketosis. They were lean and metabolically healthy. So these are not obese people. They've got good, meaning lower triglyceride numbers. They've got higher HDL numbers. And they've got various other markers indicating that they are not in chronic inflammation, that they're metabolically healthy. So these are your lean mass, metabolically healthy people, and they've got very high LDL because they're on a ketogenic diet specifically.
Exactly.
Okay. And how many people did you look at, and how did they reflect the general population in terms of, say, their demographic features or anything else that one might care about when we start to think about whether these results will generalize?
Yeah, so we enrolled 100 of these participants, scanned them at baseline using the CT angiogram. So that's an advanced metric of plaque assessment. We looked at quantitative plaque in the coronary arteries, how much plaque is present, soft plaque, hard plaque, all the different plaque components. We followed them for a year. They had to stay in ketosis. We monitored them. They had to be remaining on the keto diet. And at the end of 1 year, we scanned them again to look at the change in plaque over the course of a 1 year time point.
Mm-hmm, mm-hmm. And so did you remind me, how did you guys confirm that they were in ketosis the entire time? And what kind of tracking did you do for their diet in terms of knowing exactly what they were eating and what the fat content was?
Yes, so they had to do regular finger sticks to prove that they were in ketosis. We also measured their LDL and advanced lipids at baseline and at follow-up. So we had a home monitoring during the year, and then we had formal testing of both ketones and LDL at baseline and follow-up in the trial.
Mm-hmm. So these people are they're bona fide ketosis. You're checking that. You're checking ketone body levels, and you're measuring these lipids and other things. Before we get into the results, one more question I have is: there's not just one way to be in ketosis, right? So all of these people could be having very, very little to no carbohydrate intake, but their fat intake could still, while it's high across all of them, it could still differ a lot from person to person. Some might be having more saturated fats, some a lot of polyunsaturated fats, and everything in between. Did you look at the fatty acid composition of their diet and how that varied at all?
We have not. We have the blood work. We haven't delved a lot into how they got to ketosis, and there are a variety of ways and a variety of diets. So, and because it's only 100 people, we're a little bit nervous about trying to subset it too many times because it's not a huge cohort.
Mhm,
So,
mhm.
you don't want to do too many what we call subgroup analyses when you have a smaller cohort that you're playing with.
Okay, so maybe a question for another day or something to keep in mind for people interested in this stuff is, something I'm very interested in is, what happens if you have a high saturated fat ketogenic diet versus a high mono or poly unsaturated fat ketogenic diet. We don't know the answer to that yet, and you guys weren't really in a good position to look at that specifically here, but you know that these people are in ketosis because you're confirming that, you're following them for a year, and you've got 100 of them,